Today we are going to see about osteoarthritis. Okay, it is one of the degenerative diseases that we can see in the elderly. Okay, so any itis, itis means inflammation. Arth means joint. Okay, so we have osteoarthritis, which is an inflammation of the joints, and it is a degenerative disease that is commonly seen in the elderly people. Okay, it is also seen in younger people, but more commonly it is seen in the elderly people. So what are we going to study in this chapter? We're going to see about the synovial joints, which you would have studied in your anatomy in first year. Then we'll see what is osteoarthritis, the epidemiology, distribution of the disease, etiology or causes and risk factors, pathogenesis, clinical features, differential diagnosis, investigations and management. Okay, let's start off with the anatomy. See, this is the synovial cavity. We have different types of joints, and one of the common joints that we have in the body is the synovial joint. And one of the features or few of the features of every synovial joint is that it has a synovial cavity. There is a bursa which covers the joint area, and there is a articular cartilage. The bones which come together to form a joint, they are called the articular bones, and there is a cartilage that surrounds each of these bones. Okay, so that is the articular cartilage, and each of the synovial joint has a synovial capsule and synovial lining, and the synovial fluid is present in between. So all this synovial capsule, synovial cavity and the synovial fluid, everything, and even the articular cartilage is present there to protect the bones and to have smooth movement in the joint. Okay, so when there is any change in the synovial fluid, or the space in the synovial cavity is decreased, or there is damage to the articular cartilage, then it leads to degeneration of the joint surfaces. These two bones together form the joint, and when any of the structures of the synovial joint is damaged, it leads to degeneration. Okay, and it is commonly seen in old people, and that is mainly because of wear and tear. Wear and tear means they have been using it for many years, and so the surface of the joints become damaged because of repeated use. That's why it's called as wear and tear. So what is osteoarthritis? Osteoarthritis is a degenerative disease of synovial joints characterized by focal loss of articular cartilage with proliferation of new bone and remodeling of joint contour. So these are the joint surfaces. The articular cartilage gets damaged. The cartilage that is present to protect the bone ends becomes eroded here, and it becomes damaged. So what happens is new bone is formed. Okay, and remodeling of the joint contour. So a normal anatomy, the joint is present in a particular shape, but when the surfaces are damaged, it becomes remodeled. One simple example of telling about this is, you have seen leprosy patients in our wards, and they have wounds in their legs called ulcers. So when these ulcers form, they change the contour of the foot. Okay, the shape of the foot becomes changed because of the wound. Same way, when the joint surface or the articular cartilage becomes damaged, it causes change of the joint surface, and then it is called as osteoarthritis. Let's see the epidemiology. It is commonly seen in the weight bearing joints. Okay, what are the weight bearing joints? Hips and knees are the common weight bearing joints. When we stand, the weight of the body goes through the knee joint, after it goes through the hip joint. So these are the major weight bearing joints, and so these become damaged in people who are above 65 years. Okay, and 80% of these people above 65 years have radiographic changes. If you see in the x-ray, you will find that the joint surface has got eroded and there is new bone formation in some of the people. And Even though radiographic changes are present in 80% of the population above 65, only 25 to 30% have symptoms, that is pain and other symptoms. Okay, it is more commonly seen in women, and it has a genetic tendency, so familial tendency is there. So that's the epidemiology. Let us see the distribution of the disease. What are the causes? So distribution of the diseases: knee joint, hip joint, and also in the foot you can get from ankle and other joints, and people also have it in very rarely in the upper lip. Etiology: what are the causes? See, one is the primary or idiopathic cause. Idiopathic means there is no obvious cause, there is no other known cause. Okay, so most of the diseases you will have an idiopathic cause. So when there is no other predisposing factor, then it is called as osteoarthritis with idiopathic cause or primary osteoarthritis. When this osteoarthritis occurs following some systemic problem or a local problem, okay, then it is called as secondary osteoarthritis. So what are the causes of secondary osteoarthritis? Hip dysplasia. Okay, when the child is born in the early stages itself, hip dysplasia can be there. The joint surface is not proper, so that can cause osteoarthritis of the hip. Then endocrine problems, acromegaly, can lead to osteoarthritis in the later stage. Traumatic, any fracture, or football players when they put a lot of stress on their knees and hips, and they have had meniscectomy. Okay, so the meniscus of the knee joint is removed. So these are all traumatic causes. When people have fallen, when they've had accidents, when there has been a fracture, and there are various other factors. All these are traumatic causes of secondary osteoarthritis. Then if the person has had inflammation due to rheumatoid arthritis, gout, or septic arthritis. Septic arthritis, when there has been an infection in the joint, it can lead to septic arthritis. Then metabolic cause, alkaptonuria, Wilson's disease are metabolic causes. Aseptic necrosis due to corticosteroid use. Okay, systemic lupus erythematosus or SLE. Then sickle cell disease. Here there is aseptic necrosis of the joint. Then neuropathies, when there is nervous system disorder, and diabetic mellitus and syringomyelia. Okay, these are causes of neuropathic causes of osteoarthritis. Then Paget's disease and Gaucher's disease are the other causes of secondary osteoarthritis. So these are all the secondary. The risk factors of osteoarthritis. What are the risk factors? Okay, some people are at high risk of getting osteoarthritis. One is the constitutional susceptibility, that is based on their body. If they are having parents who have had osteoarthritis, then they are at higher risk of getting osteoarthritis. And their hormonal status, okay, that can lead to osteoarthritis. Obesity can lead to osteoarthritis. The person is having excessive weight, so the weight is going through the hip and knee joints, so they are put at excessive wear and tear. Then high bone mineral density. So when the bone has high mineral density, that can also lead to osteoarthritis. Then mechanical factors. So that is because of activity. So trauma, that is people who had accidents, who have fallen on their knees or hips, who have twisted their knees or hips. And then abnormal joint shape, abnormal alignment. Okay, it can be post a fracture or post any other reason. And excessive usage due to occupational cause or due to recreational cause. Those who are playing in without any, those who play in cricket and football, that's also part of their occupation. It's not recreation, so that is an occupational cause. Recreational is people who play in their near their house. Okay, it's not a job for them, it doesn't earn an income, but it's a recreational playing. So that can also, when they have had injuries, it can lead to osteoarthritis. One common factor which connects the constitutional susceptibility and mechanical factors is the aging. So that's why you're studying about degenerative osteoarthritis in geriatrics. Okay, so aging is a common risk factor. As the person gets older, each of these factors increase the risk of the person. So normally itself, aging can lead to osteoarthritis, but when these factors are present, it leads to a increased chance of osteoarthritis. So what happens? What is a pathogenesis? There is a progressive destruction of articular cartilage. Okay, so progressive destruction, the word, it's a key word. So initially there may not be much damage, but as time goes, as the person becomes older, there is increased destruction of the articular cartilage. You know what the articular cartilage, it's the cartilage that lines the surface of the bones which form the joints. So that cartilage becomes damaged progressively, and that leads to exposure of the subchondral bone. So when the articular surfaces are damaged, the bone becomes exposed. Okay, and there is increased blood vascularity. So there is increased blood supply. So usually when there is a damage in our part of the body, there is increased blood supply to heal that part. Okay, so here also there is increased vascularity, and along with that there is cyst formation. Okay, in the diagram you can see the cyst formation. So when this cyst and other things are formed along with damage to the articular surfaces, it causes pain and it leads to degeneration of the bones, further degeneration. So what are the clinical features? What happens to the people who suffer from osteoarthritis? The first and most common clinical feature is the pain, or the symptom is the pain. So the pain is activity related. So whenever a person is walking or doing any activity, the pain increases. When there is weight bearing, the pain increases. When a person is standing or walking, the pain increases, and it varies over time. That is, all the time the pain is not constant. Sometimes it is more, sometimes it is less. And one of the main aspects of osteoarthritis is only few joints are affected. Okay, hip or knee or both. So very few joints. It, unlike rheumatoid arthritis, we will be seeing about that in differential diagnosis. Then usually in osteoarthritis there is morning stiffness that lasts for less than 30 minutes. Up to 30 minutes they can have stiffness in the joint which is suffering from osteoarthritis. Because of the pain, the person can have restricted functionality, and other than that, because of the thickening of the capsule, the remaining part of the articular capsule which is present, that can become inflamed or thickened, and osteophyte or new bone formation in the joint surfaces, it can also block the movement. So the person will not be able to have full range of movement in the affected joint. So what are the general osteoarthritic findings? Pain, stiffness, swelling, okay, and Heberdin's nodes or some node like inflammatory areas, okay, in the joints. And then this is common in the first carpometacarpal joint, okay, and it leads to osteoarthritis in other joints, especially the knees. So what are the clinical findings? We see that there is patellofemoral and medial tibiofemoral area being affected. Pain is localized to the anterior and medial aspect, the anterior aspect and the medial aspect of the knee, and also the upper tibial area there is pain. The person who has osteoarthritis will be walking with a jerky gait because of the severe pain that they are suffering from. They will have a jerky movement. So that's the reason for this is when they are walking, there is a sudden pain, they will try to shift the weight to the other leg. So that is why they have this jerky gait. Then there is varus deformity, that is varum. Okay, you can see the space between both the knees is much higher than a normal person's. Okay, here it is tapering, whereas the space here is more, that is varus deformity. Then tenderness over the periarticular joint line, weakness and wasting of the quadriceps muscle. See, the quadriceps muscle gets inserted into the patellofemoral area, or this area. So what happens is, because they do not use the knee joint as much as they should because of the severe pain, it leads to decreased walking, and that leads to weakness of the quadriceps muscle, which is present over the anterior part of the thigh. And they also have restricted extension and flexion. See, this person in this picture is not fully extended the knee. That means they have a bent knee. So they neither do they fully straighten the knee, nor do they fully fold the knee. So that is, extension and flexion is restricted, and there is bony swelling around the joint area. So these are the key clinical findings in a person with osteoarthritis of the knee. What about the hip osteoarthritis? See, here they have mostly pain over the medial aspect of the joint, and the groin area has maximum pain, and they have something called as antalgic gait. Antalgic gait is painful gait. When you see them walking, gait is walking. So when you see them walking, you can see that they are having severe pain. So they will shift from one side to another, and they will not weight bear on for a long time on one leg. So that is antalgic gait. Then there will be weakness and wasting of the quadriceps and gluteal muscles, because they will be protecting their joint and will not be using it. Finally, there will be pain and restricted internal rotation. Okay, this we are going to skip because we are not studying about early onset osteoarthritis. So what are the differential diagnosis? How do we differentiate osteoarthritis from other types of arthritis? The common arthritis that people suffer from are rheumatoid arthritis and gout. Okay, based on the symptoms. In osteoarthritis, systemic symptoms are not present. Only in the joint which is affected there are symptoms. But gout and RA, there are symptoms in other areas. Duration of morning stiffness, only for 30 minutes or up to maximum of 60 minutes in osteoarthritis. In rheumatoid arthritis, it lasts for a long time, and it's not seen in gout. In the nodule presence, Heberdine's nodules is present in osteoarthritis, and it is absent in gout and rheumatoid arthritis. Then movement increases the pain in osteoarthritis. See, one differentiating factor. In rheumatoid arthritis, when a person keeps moving their joints, it decreases the pain over a period of time. Whereas in osteoarthritis, any movement will exacerbate or increase the pain. In gout, there is no change in the pain. And the age of onset, it occurs in elderly. Osteoarthritis occurs in elderly. Rheumatoid arthritis occurs in any person, and the gout is also found in younger people. Okay, and then lab finding, we find that the rheumatoid factor is negative in the osteoarthritic patient. The common investigations that we can do to diagnose this disease is a plain X-ray, which will show that there is narrowing of the joint space, and there will be subchondral sclerosis, and there you can also see osteophyte formation in some of the X-rays. Okay, here there are marginal osteophytes which are present, newborn formation. Then cysts are present, subchondral cysts. Investigations we can do are blood test, full blood count, ESR, CRP, all are normal, and rheumatoid factor is negative. Okay, in a rheumatoid arthritic patient, rheumatoid factor will be positive. The synovial fluid analysis can be done. It will be viscous with low turbidity and calcium phosphate. So all these investigations are secondary. Just by seeing at a X-ray, most of the orthopedicians will be able to diagnose osteoarthritis, and as an older person comes with osteoarthritis of the knee and hip, it's easy to diagnose. So let's see the management. How do we treat this condition? Pharmacotherapy, non-pharmacotherapy, surgical interventions. Okay, non-pharmacotherapy, explain the problem to the patient. It's a old age problem, so they have to position themselves in a proper way and provide support to their joints. Okay, and physiotherapy can be started. Joint movements will or exercising the joints will help in having full range of movement. They will have full flexion, extension, and it will help them in slowly reducing their weight if they are excessive weight. Reducing their weight will help in reduction of pain. Okay, and you can also provide supportive therapy, like you can give heat therapy to the affected part, strengthening of the muscles that are weak, and you can also provide support with a crib bandage for the joints, so that especially if it's a knee joint, so that they can walk confidently. Aerobic exercises, muscle strengthening exercises, weight loss, appropriate footwear, all these can help. Okay, then pharmacotherapy. What are the medicines that can be given? Paracetamol, it's a common drug, non-steroidal anti-inflammatory drug. Then opioids can be given. Okay, ibuprofen, all these non-steroidal anti-inflammatory drugs. And in patients with severe pain, they are given corticosteroid injections, and that is given intra-articularly, so that they have immediate pain relief. Okay, and they have normal function, but it is given only when they have severe pain. And hyaluronic injections can be given for 3 to 5 weeks, and this can lead to pain relief for several months. So if a person is suffering from a lot of pain, this is the intervention that is given. But mild pains, paracetamol, NSAIDs are given commonly. Surgical treatment, this again is done only when the person is having severe osteoarthritis, and it is not done for those who have mild pain. And osteotomy can be done, joint replacement, total joint replacement. Okay, either a partial joint replacement or a total joint replacement. Whenever the joint surfaces are damaged or eroded beyond repair and the supportive therapy is not giving pain relief, then joint replacement is the main treatment of choice. But remember, if the person is obese, first they have to reduce the obesity before the joint replacement is done, otherwise they will still suffer from pain. Okay, yeah, so that's the end of the degenerative disease, that is osteoarthritis, which is commonly seen in old age.